began. 70-year-old existing diagnosis of 5 centimeter aortic aneurysm and atrial fibrillation with acute onset of abdominal pain radiating to his back. He is still actively bleed. Evaluations shows the following: blood pressure 90 by 40, rate 140. Decision is made to proceed with surgery within the next 30 minutes. Which of these is the most appropriate management of warfarin therapy? Give 5 mg vitamin K intravenously. Stop and commence treatment dose enoxaparin only. Continue warfarin but bridge with enoxaparin immediately. Give 4-factor prothrombin complex 25 by 50 units per kilogram or begin with warfarin and enoxaparin until good evening INR in range. So on warfarin, and if immediate surgery is required in such condition, always give 4-factor prothrombus concentrate 25 by 50 per kilogram. Okay, why not other? Let's see. Surgery can wait for 6-8 hours. Give 5 mg vitamin K IV. PR interval on ECG. Ventricular impairment. Coccus viridans isolated on blood culture. Which one is the best answer for surgical intervention? The best answer here is lengthening of PR interval on ECG. Why? Because it will be abscess. Yeah, aortic root abscess will require surgical intervention. Now, 65-year-old with chronic kidney disease is found to have deficiency of antithrombotic after he presented to the emergency department with leg pain and swelling. A Doppler ultrasound scan of the leg caused deep vein thrombosis (DVT). A patient is started dibigatran. What is the mechanism of action of dibigatran? Activates antithrombin 3, P2Y12, glycoprotein 2B3A inhibitor, direct inhibitor, or direct factor 10 activator. What is the mechanism of action? The best option. What is the mechanism of action of dibigatran? So there is D for dibigatran, D for direct inhibitor. Okay, so this is a direct thromboter. Glycoprotein 2B3A inhibitor are MAB. Okay, abciximab, not dabigatran. Factor 10A inhibitor is rivaroxaban. Let's see. Heparin activates clopidogrel is P2Y12 inhibitor. Rituximab is glycoprotein 2B3 inhibitor. It's direct thrombin inhibitor. Rivaroxaban is factor 10 inhibitor. Now, which one is the cause of soft second heart sound? Aortosis, aortic regurgitation, mitral regurgitation, or pulmonary hypertension? So which one is the best answer here? Soft second heart sound. So the answer here, aortic stenosis. Second heart sound, S2 in loud hypertension, soft aortic stenosis, ASD, reverse displete left bundle branch block, or soft and severe aortic stenosis. Now, 62-year-old man, 2 hours after a successful elective decision for atrial fibrillation. 6 weeks ago, he presented in fast atrial fibrillation was made at the time of warfarinized weeks, which he was aborted. During this time, he had a normal echocardiogram. He has no past history of note other than treatment for cell carcinoma. What is the most appropriate anticoagulant? can stop immediately. Continue warfarinization for 1 week, then review follow. Lifelong warfarin, lifelong aspirin. Continue warfarinization for 4 anticoagulant. So the best option here is continue warfarinization 4 weeks, then review. Okay. 34-year-old female presented preceded by an occipital headache of onset on examination. She was conscious alert with photophobia but no neck stiffness. What is the appropriate further management? Brain with contrast. Repeat CT brain in 20 hours. CSF examination, angiography or MRI brain. Vomited by occipital headache of acute onset. Conscious alert photophobia but no neckness. CT brain normal. Management is CSF examination. 23-year-old presents with recurrent headaches. This typically 2 or 3 times a month and are characterized severe right-sided headaches which are throbbing in and last around 8-12 hours. When the headaches, he finds it hard to carry and tends to go and lie down in dark room. The headaches so far have responded poorly to paracetamol. Which one of the following medications should be prescribed to help reduce the frequency of these headaches? So I hope now diagnosis here is migraine. This is a case of migraine. So they are asking the medication help frequency of headache means prophylaxis of migraine. Which medication you are going to use? Ibuprofen, Pyzothifen, propranolol, and carbamazepine. So which medication you are going for prophylaxis of migraine? In prophylaxis of migraine, we are going to use, yes, Dr. Medicos, you are absolutely right, propranolol. Now, 34-year-old man got in by his wife following a mechanical fall, standing in which he hit his head and lost consciousness for around 10 seconds. He has full of the event leading up to the fall, but no memory 30 minutes following the fall. He has not vomited, complaints of headache. He has no past medical note. On examination, he has a small laceration, scores 15 on Glasgow Coma Scale, and there is no nutritional deficit. What is the most appropriate management? Arrange CT scan within 1 hour of arrange CT head scan within 8 hours of present charge with head injury advice and advise him to observe him for the next 24 hours. Keep him in the at least 8 hours. Keep him for observation at least 24 hours. So the best answer here is discharge with head injury advice and advise to observe him for the next 24 hours. Why? CT scan of his head. Not mention the criteria here. CT head within 8 hours due to his age, no past and relative begin mechanism of injury. He does this antegrade amnesia, but he would require at least retrograde amnesia immediately prior to the injury to a CT scan. This man will require monitoring to look concerned features may develop, but if he is living with his wife, it is reasonable for this to be done at home. Therefore, there is no reason to admit him for observation. Okay. Very easy question. Lateral medullary syndrome. You increase your dimension, Amita. Increase your dimension on 240, 360 sound. Lateral medullary syndrome is caused by occlusion of which of the following blood vessels? Inferior cerebral artery, posterior cerebral artery, lateral sinus thrombosis, middle cerebral artery, posterior inferior cerebral artery. So which one is the best answer? Other name of lateral medullary is this also known as posterior inferior cerebral artery. Okay. Now, lateral medullary syndrome or PIC, cerebral sinus contralateral sensory loss, anterolateral corners. Okay. Now, 53-year-old woman with a sudden onset left-sided arm and leg weakness. She has a background of atrial fibrillation for which she anticoagulated with warfarin and suffers from Alzheimer's, for which she takes donepezil on her own in a ground floor flat with helping with her activities of daily living twice daily. Her family live fairly close by. Recently, she lost a husband who died from metastatic lung cancer. Reports having forgotten to take her medications on several occasions. Examination, she did not have any slurred. Let's discuss why. Radiological investigation for suspect stroke. Okay. So, old man presents with a 8-month history of generalness. On examination, he has fast and weakness in both arms and absent reflexes. Examinations of the lower limbs reveal increased exaggerated reflexes. Sensation was normal and there were no signs. What is the most likely cause? Progressive muscular atrophy, mitral sclerosis, B12 deficiency, myelina, or multiple sclerosis. What is the best answer here? What this patient suffering from? This patient is suffering from amyotrophic lateral sclerosis. Fasciculations, bone disease. These symptoms are typically of amyotrophic lateral sclerosis, the most common type of bone disease. It involves both upper motor neuron and lower motor neuron. This is from amyotrophic lateral sclerosis. He mentioned that his urine has brown in color. On examination, his noted to be 170 by 110. Kidney biopsy stain positive for autoantibody confirming diagnosis of good pasture syndrome. Which of collagen does this patient produce autoantibody? Collagen type 1, type 2, type 3, type 4, type 5. Type 1 is for osteogenesis imperfecta, is type 4, good pasture. Okay. Danlos syndrome is primarily caused by genetic defect in collagen type. Collagen type 5 also affected. In type 1 osteogenesis imperfecta, good pasture, type 4 collagen defect. Okay. A 80-year-old gentleman on a care of the elderly. He is waiting social care and is well. The nurses have asked you to review. He is becoming increasingly confused. His condition normal. You ordered some blood. So 3 means hyponatremia, potassium 4.5, U6, creatinine 91, it's normal, chromol, it's normal. In light of low source and urine osmolarities are ordered plasmolarity low 182, urine osmolarity high, and urine sodium concentration 51. What is the most appropriate initial? Firstly, you have to understand this is a case of IADH, syndrome of inappropriate anti-diet hormone, where we see there is hyponatremia, serum osmolality low, high. So how to treat SIADH? The treatment of SIADH practice fluid restrictions. Repeat. This patient has SIA. Initial treatment is fluid restriction or some other tolvaptan, demiclocycline, etc. 60-year-old gentleman presents to the emergency department with drowsiness, confusion, and some nausea and vomiting. He attends him and tells you that he has been feeling tired and run down with persistent cough, and he has smoked 20 cigarettes per day. For the patient himself is unable to give a full history due to the confusion, but is able to tell sometimes he brings up blood when coughing and his urine has been darker than usual. But he did not want to water. On examination, he appears euvolemic, short of breath. After taking some blood, you find low serum sodium, high urinal sodium, a low plasma osmolality, high urine osmolality, renal and thyroid function test normal, chest X-ray indicates cancer, and so you suspect this presentation may cause a syndrome of inappropriate androgen hormones secretion (SIADH). What underlying mechanism causing hyponatremia? Very interesting question. Inhibition of sodium chloride co-transporters, insertion of potassium chloride co-transporters, of aquaporin 1 channel, insertion of aquaporin channel, inhibition of sodium glucose synthetase is the best answer here. The single best answer here is 2 channels is the best. Okay. Yeah. Antidiuretic hormone promotes water reabsorption by insertion of aquaporin 2 channels. Which one of the following food is the best source of folic acid? Which is the best source of folic acid is? Which one of the following food is the best source of folic acid? Cheese, red meat, fish or milk? Best answer here is liver. Okay. Acid is also present in green vegetables and nuts. A new drug is being developed by a pharmaceutical company. Yeah, it's liver. Pharmaceutical to help treat ovarian cancer, which phase of clinical trials specifically looks at the of the drug. Phase 1, phase 2, phase 2B, phase 3, phase 4. New drug is being developed by a pharmaceutical company and they want to see the efficacy of the drug, which phase it comes under. So the phase 2B. Now 58-year-old, it's 2B. 58-year-old man with polyuria, polydipsia. His mass index is 32 kilograms per meter square. A random blood glucose 11.5, confirming the diagnosis of dialysis. You decide to start him on metformin. What is dipeptide peptidase DPP4 inhibitors, SGLT2 inhibitor, or activation of the AMP activated? So guys, SGLT2 canagliflozin, SGLT2 inhibitors, whereas DPP are phenylephrine, sexagliptin, sitagliptin, vildagliptin, and metformin of AMP activated protein kinase. Sulfonylurea is active, whereas PPAR gamma is thiazolidine. Okay. Now, you are F2 working in a general practice, seeing a 64-year-old female who has diabetes. Her HbA1c remains high despite trial of diet and lifestyle changes. You plan to her on most commonly prescribed first line medication for diabetes. Which side effect would you warn her is the most likely? Headache, diarrhea, hypoglycemia, constipation, urinary tract infection. Metformin milk, most common side effect, Iguanides, most common side effect is diarrhea. Yes. Diarrhea, gastrointestinal defects such as diarrhea and bloating are the common side effects of metformin. 30-year-old female admitted to the medical take with an acute infection. She had a case of anaphylaxis thought to be due to amoxicillin at the age of 3. She has since been seen by the allergy specialist and is now known to have an IgE penicillin allergy. Which of the following antibiotics would you be most wary of using in this patient? Gentamicin, ciprofloxacin, trimethoprim, cephalexin, or metronidazole. So you are going to be worried with a patient which is allergic. So answer here is cephalexin. Okay, small proportion 0.5 to 6.5% of patients with mediated penicillin allergy will also cephalosporins. For an old woman is about to start treatment with trastuzumab for metastatic cancer. What is the most important condition to perform prior to initiate treatment? Pulmonary function test, echo, liver function test, chest x-ray, tolerance test. So the answer echo, because this trastuzumab have a cardiotoxicity. That's why I go with echo first. That old man presents to the emergency department after out having taken an unknown substance. He is known to have a history of depression. On addition, his Glasgow Coma scale is 13 by 15. Pupils are dilated and divergent. His heart rate of 110 per minute. Pressure is 124 by 70 and his ECG shows with a lengthened QTC duration 30 meters second. He is dry to the touch, which is the most likely to have ingested cocaine, sertraline, diazepam, amitriptyline, and pupils dilated, tachycardia, blood pressure, and lengthening QTC. So, dilatation of pupil with amitriptyline, not with cocaine. Now, which one of the following is the least associated with cocaine toxicity? Metabolic alkalosis, hyperthermia, psychosis, rhabdomyolysis, seizures. So, cocaine toxicity, they are asking least associated toxicity. So answer is in cocaine toxicity we see hyperthermia, psychosis, rhabdomyolysis, seizures, and metabolic acidosis. No metabolic alkalosis. So the best answer is alkalosis. Which of the following would cause a fall in carbon monoxide factor TLCO? Acute asthma, Wagner's granulomatosis, polycystic exercise, or emphysema. Increased transfer factor are acute asthma, Wagner's polycythemia, exercise. All other are. So answer here is emphysema. Emphysema, yeah. Raised is asthma, hemorrhage, left to right shunt, polycythemia. All others are. 33-year-old woman prescribed varenicline to help her quitting What is the mechanism of action of varenicline? Norepinephrine and dopamine reuptake inhibitor, nicotinic antagonist, dopamine agonist, dopamine antagonist, selective serotonin or nicotinic receptor partialist. So the best answer here is warning is nicotinic receptor partialist is the answer. Now you are reviewing the results are from investigation requested at the previous respiratory clinic. A 40-year-old man is being investigated for increasing shortness of breath. The notes show he has smoked for past 25 years. Pulmonary function test reveals the following: FEV1 1.4, FEC 1.7, FEV1 or FEC is 82% more than normal. Which of the following is most likely explained here? Asthma, bronchiectasis, scoliosis, obstructive pulmonary disease, COPD, or laryngeal malignancy. The answer here is scoliosis. These results show a restrictive picture which may result from a number of conditions including scoliosis. Okay, now which one of the following is tests? FEV1 1.9 liter, FEV it's 1.9 liters. Histology shows squamous cell, vocal cord paralysis, or calcium 2.8 millimoles per liter. For surgical rejection in lung cancer is vocal cord paralysis. For example, contraindication others are vena cava obstruction, FEV1 less than 1, malignant pleural effusion, and vocal cord paralysis. 27-year-old woman reviewed in a clinic. She currently uses salbutamol inhaler 100 micrograms combined with beclomethasone dipropionate inhaler 100 micrograms BD. Despite this, she had frequent exacerbations of her asthma. Recently required a course of prednisolone. What is the most next step in management? Add a receptor antagonist, add tiotropium, salmeterol, start to take the salbutamol, puff QDS, or switch beclomethasone picazone. The best answer is add a leukotriene receptor antagonist. Add a leukotriene receptor antagonist. Okay. Now, 7-year-old male presents with generalized lymphedema. Which one of the following is least likely to presentation? Kawasaki disease, cytomegalovirus, acute lymphoblastic leukemia, phenytoin infectious mononucleosis. So the best answer here is why? Because here is no generalized lymphadenopathy, only cervical lymphadenopathy. In rest of the disease, there is lymphadenopathy. Okay. 34-year-old man who is HIV positive, starting treatment of a Burkitt lymphoma. Therapy regime includes cyclophosphamide, methotrexate, prednisolone. 24 hours after starting chemotherapy, he becomes confused and complains of muscle cramps in his leg. One of the following is most likely to occur: prednisolone-induced psychosis, hypercalcic cystitis leading to acute renal failure, tumor lysis. So chemotherapy. So this is a case of tumor lysis. Tumor lysis syndrome occurs as a breakdown following chemotherapy. This releases a large quantity of cellular components such as potassium, phosphate, and uric acid. Okay. Patient is chemotherapy for metastatic colorectal cancer. What is the main advantage of using capsaicin instead of fluorouracil? Current data shows increased survival, less toxic oral administration, less nausea, no renally excreted, therefore can be used in patient with chronic kidney disease. So the best answer is capcitabine we use orally. That advantage. Yeah. 67-year-old woman referred to the hematology clinic. Her GP has noted that her platelets are elevated and no reactive cause be found. Bloods taken a week before clinic as follows: hemoglobin 15.4, platelets 7 lakh 84, WBC 5.3, JAK2 is V617F mutation positive. What is the treatment of choice? Imatinib, stem cell transplantation, hydroxycarbamide, vincristine, or venesection. So the best here is hydroxycarbamide. Yeah. 67 reviewed 6 months after she had a mastectomy following a diagnosis of breast cancer. Which one of the following tumor marker is most useful in monitoring her disease? CA120, CD34, CA153, CA199, CD117. This is 153. Absolutely 99 is pancreatic cancer, one is ovarian cancer. Okay. Now, a year-old woman who has had a hysterectomy is advised about hormone replacement therapy. Which one of the following would result from the use of a combined estrogen progesterone preparation compared to an estrogen preparation? Increased risk of venous embolism, increased risk of stroke, increased risk of breast cancer, increased risk of endometrial cancer, better control of symptoms. The best answer here is for breast cancer. Progesterone responsible increased risk of breast cancer. Yeah. Which one of the following increases the risk of developing hepatic edema in patient taking pioglitazone? Concomitant use with gliclazide, serums less than 140, concomitant use with insulin, concomitant use with metformin, or serum 4 millimoles per liter. So the best answer is concomitant use with insulin. Yeah. 5-year-old man present with bitemporal hemianopia, pad-like hands. What is the test to confirm the diagnosis? Early morning growth hormone, insulin tolerance test, oral glucose tolerance, growth hormone measurement, random insulin like one ACTH test. So the best answer here is glucose tolerance test with growth hormone measurement. Okay, this is a case of acromegaly. Which one of the following is a least associated gynecomastia? Klinefelter syndrome, liver disease, puberty, hypothyroidism. Least associated with gynecomastia is least associated with gynecomastia. Least associated, yeah. Gynecomastia is seen up to third of men with thyrotoxicosis, but it is not a feature of thyroidism. 73-year-old presents with urge incontinence, having a significant impact on her quality of life. She has undergone supervised bladder training with no improvement in symptoms and to trial medication. She has a medical history of atrial fibrillation, well controlled hypertension, current urinary retention. What would be the most accurate first line treatment? Mira background, pelvic floor exercises, tolterodine, surgical repair. So, for this urgent condition, we advise a patient on Mira background because in atrial fibrillation patients. Confusion in elderly people. Mira is a preferable alternative. 45-year-old woman seen by her nephrologist, allogenic renal transplant. For any she continues to take prednisolone, azathioprine. What complication is the patient most at risk of? Colorectal cancer, lung cancer, breast cancer, or squamous cell cancer? So the best here is cancer. Patients who have received an organ transplant high risk of skin cancer, particularly cell cancer due to long-term use of immunosuppressants. Which one of the following is least associated with peritoneal fibrosis? Riddle's thyroiditis, previous therapy, inflammatory abdominal aortic endometrial surgate, methysurgate, or sites. Yes. So the least associated with sulfonamide. 6-year-old with background history of type 2 diabetes, hypertension, osteoarthritis, ischemic heart disease, admitted to hospital with a right lower lobe pneumonia. At his urea electrolytes are as follows: sodium 130, 4.2, urea 9.8, creatinine 140. On review medical reports 3 months ago, sodium 135, potassium 4.1, urea 4.3. Which of the following regular medication is safe to continue? Metformin, low dose, amipril, ibuprofen, or benrofluoride. In this condition, safest medicine is low dose aspirin. NSAID should be stopped, AKI, acute kidney, except aspirin and cardioprotective doses. A patient developed membranoproliferative glomerulonephritis to partial lipodystrophy. Type of complement is likely to be low C3, C2, C9, C6. So the best answer here is complement 3. Membranoproliferative glomerulonephritis type 1 is cryoglobin hepatitis C, whereas type 2 is partial lipodystrophy. Okay. 74-year-old man with stage 4 secondary to type 2 diabetes mellitus to the acute medical assessment ward with symptoms of and reduced exercise tolerance. He is systemically well. His blood results are as hemoglobin 80, mean corp 90, MCH 30, urea 17, creatinine is high, EGFR is very low. Likely cause of this patient anemia, which of the found poor patient most likely to be deficient of? In still patient, anemia is due to B12 deficiency, erythropoietin, T3 or T4. So the best answer here is it is due to erythropoietin hormone deficiency, reduced level of erythropoietin. That's why there is anemia. 31-year-old man found unconscious on the and brought by ambulance to the emergency department. He has a background of epilepsy and intravenous drugs, but no sign of local neurology. Pupil normal size, both equally react. Blood pressure 138 by 82, heart sound normal. Left calf was mildly swollen and warm to touch. Was catheterized and residual volume 340 ml of was collected. Ultrasound of his renal normal, hemoglobin 13, it's 136, platelets 136, UBC 6.85, sodium 134, potassium 3.9, urea 9.1, creatinine it's high, urinary sodium 50. Which of the following investigation most useful to identify cause of acute kidney injury? Anticonvulsants, serum creatinine kinase, liver function, blood culture, midstream specimen of urine, serum, renal arteries, and left lower limb. So here we need to do CK, serum kinase. This is a case of rhabdomyolysis, parenchymal acute kidney injury, and is characterized by elevated creatinine kinase. 52-year-old man investigated for weight loss and diet. Rectal biopsies taken and reported as follows. Deep inflammatory infiltrate from the mucosa to muscularis propria. Numerous granulomata. What is the most likely diagnosis? Crohn's disease, rectal carcinoma in situ, laxative abuse, or ulcerative colitis. So the best answer for this question is this is because here is involvement of mucosa and muscularis propria, whereas in ulcerative colitis there is involvement of mucosa only. You can increase Maharanjan on YouTube with 360, 480, 720, and then it's visible. Which one of the following is associated with esophageal cancer? Smoking, reflux disease, Helicobacter pylori, or alcohol. Not associated with esophageal cancer. Yes, Helicobacter pylori even prevent in esophageal carcinoma, protective against esophageal cancer. 30-year old man with a background of leukemia rubra presented with a 2 day of sudden onset worsening abdominal pain. On examining his abdomen, there was tenderness on palpation to his quadrant and moderate shifting dullness, and the liver was present 2 cm below the right costal margin. Given the likely diagnosis, what is the most first line investigation? A Doppler flow, CT liver with triple phase, MRI contrast enhanced, CT hepatic vein venography. So the best answer here is ultrasound with Doppler flow. Ultrasound flow, why? They are asking sensitive, and so this is a case of Bud Cherry similar flow study, very sensitive and should be the initial investigation. 59-year-old woman dysphagia. There is no history of heartburn, weight loss, or change in bowel habit. During endoscopy, difficulty passing through the lower esophageal sphincter, but no other abnormality is noted. Which one of the following is most likely to reveal the diagnosis? Firstly, we had this is a case of achalasia cardia. So, best diagnosis: esophageal biopsy, manometry, plain chest X-ray, endoscopy, or CT thorax. So here is esophageal manometry. Gold standard test for achalasia is manometry. Year-old man is called for review after a positive fecal blood test done as a part of the national screening program. During counseling for he asked what percentage of patients with a fecal occult blood test have colorectal cancer. What is the most accurate answer? 0.5 to 2%, 5 to 50%, 20 to 30%, 30 to 50%, or 55%. So the best answer is 5 to 50. Yeah. 28-year-old man undergoes an cecal resection to treat terminal Crohn's disease. Post-operative attends the clinic and complains of diarrhea. His CA is within normal limits and a small bowel and shows no focal changes. Which of the intervention is most likely to be beneficial? 5-ASA drug, azathioprine, prednisolone, infliximab, oral cholesterol. So the best answer here is it's oral cholestyramine. Why malabsorption of bile salts is common cause of diet following ileal resection. Normal small bowel study and CRP effectively comes for review. A few months ago, he developed redness nose and cheeks. This is worse after alcohol. He is concerned as one of his colleagues asked him if he had a drink problem despite him drinking 40 units per week on eczema as described above, with some pustules on the nose and telangiectasia on the cheeks. What's most likely diagnosed? Mitral stenosis, seborrheic dermatitis, related skin changes, acne, rosacea, or lupus erythematosus. So the best answer here is acne rosacea. Yeah. Which one of the following statement regarding raloxifene is management of osteoporosis incorrect? Raloxifene should prevent bone loss and to reduce the risk of vertebral fractures. Is a selective estrogen receptor modulator. May worsen menopausal symptoms. Increase risk of thromboembolic events. Increase risk of breast cancer. So the best answer here is increase risk of breast cancer, whereas the relaxation increases the risk of breast cancer. 55-year-old man present with a pain in his hands. This has been getting gradually worse over the past few months and associated with stiffness. On examination, you note bilateral sphenocarpophalangeus and distal interphalangeus. One of the digits swollen along the whole length. Most likely diagnosis: osteoarthritis, rheumatoid arthritis, psoriatic arthritis, gout, or reactive arthritis. So the best answer is this is a case of psoriatic arthritis. Inflammatory arthritis involving DIP swelling becomes a diagnosis of psoriatic arthritis, not rheumatoid. In rheumatoid, not involvement of DIP, there is PIP and MCP joint involvement. DIP in psoriatic. 54-year-old man presents to the emergency department with a 2-day history of an swollen, painful knee. Aspirated joint fluid shows calcium phosphate crystals. Which of the following blood test is useful in revealing an underlying cause? Ferritin saturation, ACTH, serum ferritin, or LDH. We have to understand this is a case of pseudo gout. Hemochromatosis we can say, so the transferrin saturation is important here. Typical presentation of an elevated transferrin saturation may indicate hemochromatosis caused of pseudo gout. A high ferritin level also seen in hemochromatosis, but be raised in variety of inflammatory process, including pseudo gout, as a part of transferrin saturation is the best. Old woman with rheumatoid arthritis asked for advice exception. Which one of the following statement is true? Said may be continued during pregnancy as woman takes folic acid 5 mg. PID should be avoided in a first second trimester. Rheumatoid should be encouraged as possible, ideally within 1 year after diagnosis, minimize the risk of complication. TNF alpha blocker absolutely in pregnancy. Hydroxychloroquine considered safe during pregnancy. So the best answer is hydroxychloroquine is considered safe during pregnancy. Now, 57-year-old man presenting in his right knee and X-ray shows osteoarthritis. He has no past medical history of note. What is the most suitable treatment option for the management of his pain? Oral with omeprazole, oral oral diclofenac, oral ibuprofen, oral paracetamol. So the best answer here is the drug of choice in arthritis is paracetamol. Okay. 54-year-old female admitted with severe pneumonia a holiday in Turkey. Blood reveals both hypo and dearings liver function test. Chest shows patchy alveolar infiltrates with solid right lower lobe. Which one of the following investigations to confirm the probable diagnosis? Sputum, urinary antigen, blood cultures, bone marrow, lumbar puncture. So the best answer here is urinary antigen. This is a case of Legionella. Legionella pneumophilia is the best diagnosis urinary antigen test. 28-year-old man who has recently returned via present with painful ulcers on genitals. On examination, you note a 1 centimeter into 1 centimeter ulcerated lesion with a red border. Also note tender lymphadenopathy in the groin. What is the likely causative agent of herpes simplex virus? Chlamydia trachomatis, Trypanosoma pallidum, Haemophilus B, Klebsiella granulomatous. Best answer here is single genital ulcer, not multiple. In case of herpes and single painful in case of Haemophilus ducrei, whereas chlamydia and trypanoma are less. So answer is Haemophilus ducrei. Yeah. 28-year-old lady reviewed in a follow-up appointment at Sewell Health Clinic. 12 months ago, she was diagnosed with syphilis and was given intramuscular benzathine blood test were taken a week prior appointment and serology results are shown TPHA positive, VDRL negative. What is the most explaining the serology results shown above? She has been reinfected and has developed. She is HIV positive. She is pregnant, or she successfully treated for syphilis, or she has been suboptimally treated for syphilis. Successfully treated for syphilis is the best answer. Yeah. 65-year-old male patient presents with back pain and dysuria. MRI shows evidence of prostatitis. A long course of antibiotics to treat his prostatitis. At a follow-up visit, she has been known to be MRSA methicillin-resistant Staphylococcus aureus. Which of the following antibiotics is most likely to have contributed this? Ciprofloxacin, gentamicin, tobramycin, pentoin. So the best answer here is ciprofloxacin. Ciprofloxacin promotes acquisition of MRSA. Although ciprofloxacin is not a beta-lactam antibiotic, its use is strongly linked to the acquisition of MRSA, as with all quinolone antibiotics. The other choice likely to lead MRSA infection or colonization. And on examining note, an ulceration with a black center with surrounding edema, he says it is not painful. What is important microbe to consider? Mycobacterium ulcerans, Bacillus anthracis, strong chikungunya virus, Mycobacterium leprae. Black center scar, ulceration, pain, not painful. So this is Bacillus anthracis, anthrax. Yeah. So guys, I already finished with this. If you have any queries, this is a test paper for PG or your new exam on November PG examination. This is very helpful. If you like this video, put like. If you are new on my channel, please subscribe it. Thank you. That's all for today.